Hello, our presentation today about yellow fever outbreak. Yellow fever virus is found in one of the viruses that exist in both tropical and subtropical areas in South America and Africa. This virus is mainly transmitted to humans by the bite of an infected mosquito. Yellow fever is considered as a rare disease among the U.S. travelers' diseases. The illness of this disease ranges from self-limited with fever to severe liver disease with bleeding. Yellow fever disease is diagnosed regarding a patient's symptoms, physical examination, lab testing, and history of travel that includes any possible exposure to infected mosquitoes. No specific treatment is recommended, but only symptomatic care is required. Here is some geographic distribution, some maps. We see that the mainly distribution is mainly through South Africa and South America, mainly in Brazil. Here are the list of symptoms of the yellow fever. We can see, as we see, it's mild disease, or it can be severely illness, and about 15% of cases might progress into severe cases. The death rate because of yellow fever is about 20 to 50% of the severely infected patients, and recovered patients have permanent immunity against subsequent yellow fever infection. The transmission of yellow fever is through primarily through a bite of infected mosquito like Aedes or Haemogenous species of mosquitoes. Humans with yellow fever virus infection are prone to transmit this infection to mosquitoes shortly before the fever started and up to 5 days after the fever started. Transmission of this yellow fever virus occurs in 3 cycles: jungle, intermediate, and urban. For preventing ourselves from yellow fever, we have to take multiple steps. You have to avoid bites of these infected mosquitoes, use insect repellent, wear proper clothing to reduce mosquito bites, increase awareness about the peak mosquito hours, and most importantly, get vaccinated against this virus. So yellow fever outbreak was reported in 2017 by the Ministry of Health in Brazil in multiple states of the eastern side in areas which were not known to be risk for yellow fever. Many yellow fever cases appeared again at the end of 2017, especially in the areas of São Paulo state, and in 2018 the surveillance system reported a case in Dutch traveler who had stayed near the São Paulo metropolitan region. The WHO, and in response to the outbreak, expanded the list of areas where vaccination of yellow fever is recommended to take place among international travelers to Brazil. In addition to those Brazilian areas of yellow fever, vaccination has been recommended before and after the most recent outbreak. It's also recommended for travelers or residents for the following areas. Here are some steps of yellow fever outbreaks investigations that were taken. Identify, prepared, and trained investigation teams, and prepare this team for the field work. Confirm the existence of yellow fever outbreak. Verify the diagnosis of yellow fever cases, define the cases of yellow fever, identify cases with infection and controls without an infection, implement descriptive epidemiology and develop hypotheses, evaluate this hypothesis and initiate extra studies as necessary, implement and control prevention measures, communicate findings and conduct the results of these studies, and finally maintain surveillance. Here are the current recommendations by the WHO for international travelers who are traveling to Brazil: vaccines, adopt measures and implement the rules in order to avoid the bite of vectors, increase the awareness and educate about yellow fever symptoms and signs, and acquire care whenever any of these signs of symptoms appear during the travel and after the coming back from highly risk areas. And here are some references. Thank you very much.